So I want to take a little while to talk about degenerative disc disease and low back pain. All right, so for many people, you get an episode of back pain, you go in and get x-rayed or have an MRI done, and you get diagnosed as having degenerative disc disease. Now, what I want to talk about is this something to really be concerned about? Okay, so there's two different research papers that I want to talk about. One, they did an MRI on people of all different ages, from their 20s all the way up to their 90s. And these people did not have pain. And what they found is that the older we get, the more likely you are to have degenerative disc disease. So basically what it's saying is that degenerative disc disease is a normal part of aging. It happens in all of us. Just like my beard is gray, it's gotten gray as I've gotten older. My face doesn't hurt because it's gray. As we get older, the insides of our bodies change. We get some degenerative changes in our joints, in our spine included, in the discs included, and this is a normal part of aging. All right, so it's common in people without pain, normal part of aging. Now here's the kicker though. There's another study that came out that shows that people with degenerative disc disease are more likely to experience pain, okay? So we can't negate it completely. Now here's the analogy that I like to use to explain this. If you've ever had a campfire and have used kindling to start it, small little pieces of stick that will help you start your fire, I relate degenerative disc disease to kindling. All right, so just like kindling, with kindling, it will help you start a fire, but it won't start the fire on its own. It needs a fuel. So in relation to degenerative disc disease is not going to cause pain, but it needs a spark or a fuel to maybe set the pain episode off. So with back pain, what could this spark be? It could be doing a new activity that we're not used to. It could be lifting more than what we're used to, right? It could be sitting more than what we're used to. But also we have to consider other things. It could be that our lives have been stressful lately. It could be that we're not sleeping as good as what we normally would. We're not getting as much sleep. We're restless when we sleep. It could be that our diet went to crap, that now, for a while we've been eating bad, causing some inflammation in our body. Now we start getting back pain, all right? So when we're talking about degenerative disc disease and its relation to back pain, degenerative disc disease is a normal part of aging, but it may predispose you to getting back pain reoccurrences more frequently. Some of these reoccurrences may be caused by something physical. Other times we have to look at what's going on in your life. And so when we treat this, it's not just about the spine, it's about taking care of your overall health and trying to find ways to improve that. So if you have any questions, just make a comment below. I'd be happy to set up a time to talk with you, and let's get you moving better despite being diagnosed with degenerative disc disease.